The challenge is that there has been a study done many, many years ago looking at the risk of breast cancer and hormonal replacement therapy. And the study found some association between long-term use of hormonal replacement therapy and breast cancer. And this study has been a gold standard for replacement therapy prescription since then. A lot of doctors and a lot of, again, the big part of healthcare community are still subscribing to this view and therefore discouraging women from taking hormone replacement therapy at all or for a long time. Now, this has been debunked since there has been more and more data that has been having reduced the bias, therefore providing a bit more accurate information. We know now that this association between breast cancer risk and hormonal replacement therapy is not present.